The Silent Crisis: Breaking Barriers to Mental Health for Black Youth. Welcome to the Pink Parachute Diaries. I recently had the privilege of interviewing Terrie Beasley, a remarkable advocate whose tireless work addressing mental health challenges facing Black youth has transformed countless lives. Terrie isn't just a mental health professional. She's a visionary who has devoted her life to dismantling barriers that prevent Black children from receiving the care they desperately need. Her groundbreaking approaches to culturally responsive therapy have created ripples of healing across communities that have historically been left to suffer in silence. Today, I want to share the powerful insights from our conversation, insights that I believe could fundamentally change how we approach this crisis. Imagine being 15 years old. Your mind is a battlefield of emotions you can't name. The weight on your shoulders feels unbearable, but you've been taught that strength means silence. You've been told to pray it away, to push through, to be resilient. After all, your ancestors endured slavery. What's the little depression compared to that? This is the reality for thousands of Black youth across America right now. Not a few hundred, not even a few thousand, thousands upon thousands. Over half of youth and young adults of color report moderate to severe depression or anxiety. I'll let that sink in for a moment. Half, and 37% have experienced suicidal ideation in the past year alone. These aren't just statistics, they're children, our children. The future leaders, innovators, and change makers of our society are drowning in silent pain while we look the other way. Even more alarming, Black adolescents have experienced the highest increase in suicide attempt prevalence among any racial or ethnic group from 1991 to 2019, a staggering rise of almost 80%. This isn't just a crisis, it's an emergency that's been silently unfolding while we've been looking elsewhere. As Terrie emphasized during our interview, we cannot continue to pretend this isn't happening. Our children are dying while we're still debating whether mental health is our problem. Her words cut through the noise and excuses, challenging us to face this uncomfortable truth. The reality is, we have failed our Black youth by perpetuating stigmas around mental health that keep them suffering in silence. We've created a culture where vulnerability is seen as weakness, where asking for help is viewed as failure, and where mental health challenges are dismissed as character flaws rather than legitimate medical conditions requiring proper care. I know what some of you might be thinking, but we've always been resilient. We've always found a way to overcome. And you're right, resilience is woven into the fabric of Black identity. But at what cost? When does resilience become a burden rather than a strength? When does pushing through become a form of self harm? The Child Mind Institute and Steve Fund recognized this problem and took action. Their 2024 to 2025 national survey of Black families revealed something we've known intuitively but needed data to confirm. Black families face multiple barriers when attempting to access mental health care for their children. This groundbreaking research surveyed 1,000 Black parents of children under 18 who had concerns about their child's emotional or behavioral well being, plus 500 Black young adults aged 18, 24 who shared their own experiences seeking care. The findings weren't surprising to those of us who've lived this reality, but they provided crucial validation of what many families experience daily. The barriers are numerous and complex. Financial constraints that make therapy seem like an unattainable luxury. Lack of culturally competent providers who understand the unique experiences of Black youth. Stigma within our own communities that labels mental health challenges as weakness, historical mistrust of medical institutions based on centuries of documented abuse, transportation challenges that make regular appointments nearly impossible for working families. The list goes on, creating a perfect storm that leaves our children without the support they desperately need. As one parent in the study shared, I want my son to get help, but how can I trust a system that has historically pathologized Black behavior? And even if I did trust it, how would I afford it? This is the impossible position many Black parents find themselves in, recognizing their child needs help, but facing seemingly insurmountable obstacles to getting it. But the barriers aren't just external, they're also internal, woven into the fabric of how we view ourselves and mental health as a community. In many Black households, Terrie explained during our interview, there's still this belief that mental health issues are a sign of spiritual weakness or that they should be kept private within the family. We need to challenge these narratives while honoring the cultural context they emerged from. This is where the conversation gets nuanced. These beliefs didn't emerge from nowhere. They were survival mechanisms in a world that has historically used psychological labels to pathologize and control Black bodies and minds. The reluctance to engage with mental health systems isn't irrational, it's a response to generations of harm. But now, these protective mechanisms are hurting our children. The ACOMA Project's 2020 State of Mental Health Report, the largest ever study on mental health of youth and young adults of color, revealed something even more disturbing. 91% of youth and young adults of color report exposure to at least one source of racial trauma. 91%. Let that number wash over you for a moment. These are children carrying the weight of racial trauma while their developing brains are still trying to make sense of the world. They are experiencing microaggressions in school, witnessing police brutality on social media, absorbing the subtle and not so subtle messages that their lives are valued less. And then we wonder why they're anxious. We wonder why they're depressed. The report wasn't all darkness, though. It also revealed signs of resilience. 61.1% of youth reported having at least one person who loves them, and 57.8% remain hopeful about the future. This speaks to the incredible strength of our young people, but it also highlights the power of connection and support. As Maya Angelou once said, hope and fear cannot occupy the same space. Invite one to stay. Our youth are choosing hope despite everything. The question is, will we help them nurture it? The Ikuma Project, founded by Dr. Alfie Berland Noble in 1999 and incorporated as a nonprofit in 2019, has been dedicated to transforming mental health care for youth of color for over 25 years. Their work represents what's possible when we center the experiences of Black youth in mental health research and intervention. But even when Black youth do access mental health services, they face another insidious barrier: bias within the system itself. A 2025 study published in JAMA Network Open revealed that despite similar scores on aggression risk evaluation tools, Black youth were being labeled with high aggression risk, behavioral health flags at significantly higher rates than white youth in pediatric emergency departments, 19.8% compared to 9.8%. This is what systemic racism looks like in mental health care. It's not always overt discrimination. Sometimes it's the subtle ways Black pain is perceived as aggression, the way Black emotional expression is pathologized, the way implicit bias shapes diagnoses and treatment recommendations. As Terrie powerfully stated during our interview, our children aren't broken. The systems designed to help them are. This research emerged amid a crisis of increasing pediatric emergency department visits for suicide attempts, suicidal ideation, and self injury, which have almost tripled since 2016. Our children are crying out for help. And when they finally receive it, many are being misunderstood and mislabeled. I know this is heavy. I know it's painful, but awareness is the first step toward change. And there is hope, real, tangible hope. The findings from these studies are prompting healthcare systems to examine and address bias in their assessment tools and protocols. Organizations like the Coma Project are using their research to advocate for policy reforms, equitable funding, and interventions that center the lived realities of youth and young adults of color. Communities are creating culturally responsive mental health resources. Churches are starting to incorporate mental health into their ministries. Schools are implementing trauma informed approaches to discipline and emotional support. Change is happening, but it needs to happen faster and it needs all of us. So, what can you do? What can we all do? First, we need to talk about mental health openly and honestly in our families and communities. Break the silence, challenge the stigma, create spaces where our youth feel safe expressing their emotions without judgment. Second, advocate for mental health education in schools and community centers that specifically addresses the needs of Black youth. Push for culturally responsive curricula that acknowledge the impact of racial trauma and provide tools for healing. Third, check in regularly with the young people in your life. Really check in. Ask specific questions. Listen without trying to fix or minimize their experiences. Fourth, support organizations doing this work. The Acoma Project, the Child Mind Institute, the Steve Fund. These organizations are creating resources specifically designed for Black youth and families. Fifth, if you're a mental health professional, commit to ongoing education about culturally responsive care. Examine your own biases. Create spaces that feel safe and affirming for Black youth and families. I stand before you today not just as a podcaster sharing information, but as a human being issuing a call to action. This is not someone else's problem to solve. This is our collective responsibility. Every time a Black child believes they must suffer in silence, we have failed. Every time a parent doesn't know where to turn for help, we have failed. Every time a young person takes their own life because the pain became too much to bear alone, we have failed. But failure is not our destiny. We can change this narrative. We can create a world where Black youth don't just survive, but thrive emotionally, mentally, and spiritually, where seeking help is seen as an act of courage, not weakness, where mental health care is accessible, affordable, and culturally responsive. As Audre Lorde powerfully reminded us, caring for myself is not self indulgence, it is self preservation. And that is an act of political warfare. In a society that has historically devalued Black lives and Black minds, teaching our children to prioritize their mental health is revolutionary. It is resistance, it is liberation. I challenge each of you today to become part of this revolution, to examine your own beliefs about mental health, to start conversations in your homes, schools, and communities, to demand better from our healthcare systems, to show up for the Black youth in your life in ways that affirm their whole humanity, including their mental and emotional needs, because every Black child deserves to know that their mind is as precious as their life, and both are worth fighting for. The time for silence is over. The time for action is now. Will you join us?